On tonight's show, Monique and Tom go a little out of their mind stuck in traffic. So we'll screen a doco on stories from the Beechworth Lunatic Asylum and catch up with them later on when things begin to heat up as we discover the truth behind the kiss.
The wards were overcrowded. In many cases it was chaotic at some stages, and in other areas it was reasonably quiet because many of the patients were very institutionalised and subdued.
Because absolutely nothing was done with these people, some people were there for life. I mean, from the age of 20 to the age of 70.
Could have been locked away in here and completely forgotten about. Let's go in.
Mayday Hills Hospital, formerly known as the Beechworth Lunatic Asylum, was opened in 1867 and closed in 1995. People were admitted for the most minor of offences. As a result, people who'd be deemed by today's standards as normal ended up at the hospital.
There were people there with schizophrenia, bipolar disorder, people with cerebral palsy, people with intellectual disability, people with alcohol problems. Look, it was a huge range of people.
A lot of blind, deaf and epileptic people are locked away. Soldiers returning from World War I, World War II, as well as orphans are placed at this hospital. Chinese on the goldfields who spoke a different dialect couldn't be understood, as well as European immigrants as late as the 1950s if they could not grasp the English language. But we have cases of depression and postnatal depression. Of course, there are some seriously unwell people. We have a lot of people you'd call normal today.
And unlikely 8 signatures were required for a patient to be released. Many patients became institutionalised and were never released. It is estimated that between 6,000 and 9,000 patients died within its walls.
And as I said, there were people there who should never have been there. Many lives were ruined because people went in there and never came out, and some of them received dreadful treatment.
The hospital was severely overcrowded and understaffed. All domestic activities were completed by nurses and by the patients who were considered as workers. These duties were incorporated into their everyday activities.
The patients did a lot of the domestic work. And in effect, they were slave labour.
Every ward had groups of patients who were considered workers. Particularly the male patients worked in the vegetable gardens, on the farm, in the bootmaker's shop, a few in the carpenter's shop. Some of the female patients worked in the laundry, and a couple helped in the sewing room. And it was common practice to get these workers, as they were called, to adopt other patients as they used to call them their children.
If a patient failed to complete their duties, they often faced punishment from the nursing staff and attendants.
Yes, definitely some people were punished. Some people it was just considered, well, you know, that's what the nurse is not going to do it and that's it. But yes, there were people that were locked in single rooms, given medication. A whole range of things would have occurred because they didn't do what they were supposed to do.
But that was the way that they were controlled. They were hit. Ways were found to hit them that wouldn't be immediately obvious. So, you know, obviously some of them were well-intentioned, good people, did well, but there were a lot of them who ruled by domination.
Uncooperative patients were often put in restraints and locked in complete darkness in isolated cells.
Now, medication wasn't brought to this hospital until the 1950s. So before that, a lot of restraint is used on people. Straitjackets, restraining furniture, shackles, even locking people in cages.
The only things that were used were there were patients who wore locked gloves, like leather mittens, and they were locked around their wrists. These were people who might have been tearing things up or destroying clothing or maybe scratching or another patient or something like that. There were those. There were certainly people who were put in a harness and restrained to a chair.
Now, these patients that would try and bite the ends of their mittens off would have their teeth pulled out, one by one. That happened right up until the 1980s for some people.
Basically what happened in about 1951 is that they found that medication can control people, that we moved to what we call chemical restraint instead of bodily restraint. So it was no longer necessary to lock them up in closed doors. You could actually control them by chemical means.
Oh, well, if there was a patient who, for whatever reason, was very aggressive and running around pushing people, punching, fighting, biting, anything like that, they were restrained. Because what you've got to consider is that, and it doesn't make it right, but you were working in a ward, you might have had 50 patients and you had somebody running amok amongst them, really hurting people, or they were becoming aggressive towards staff, or there was a risk of them coming down the town and creating a disturbance. Again, there just wasn't, in a ward of 50 people, you were lucky if you had 3 nurses.
In the early years of operation, the hospital engaged in horrible and cruel treatments on the patients. One such treatment involved the use of a metal box known as the salt box.
Now at the head of the table, you could attach a metal box, affectionately known as a salt box. Now the idea of the salt box, again, is to strap the patient's head in so you can't move. But the superintendent, the surgeon, will then pour salt into your eyes. So half the pain in the head takes away from the rest of your body with whatever he's doing to you. Now these salt boxes were still here 14 years ago.
Another unfortunate treatment involved patients being strapped to the Darwin chair.
But as for a very early mental health treatment, it's a treatment by the name of the Darwin chair. Now it's a wooden chair they strap you into. Leather straps over your legs, your arms, your forehead, your torso. You're unable to move. The staff will then start to spin you around so fast for so long until you actually started bleeding from your face, your mouth, your nose, your eyes, your ears. They believe this would help by getting the bad blood out of your head. The darker the blood, the happier the superintendent.
Patients rarely recovered as they were severely mistreated and neglected.
And all sorts of incredibly dreadful things were going on. I mean, not dreadful, well, I suppose dreadful in terms of violence. There was staff raping patients, there were patients raping patients.
Now originally the men would be brought out here once a week and hosed down with a fire hose here in the courtyard, no matter what day of the year that was.
There's certainly instances of neglect. There were infections that went untreated. Their physical health was not looked after. So they might be slowly going blind and nobody noticed or cared. They very rarely see a doctor. So, that's mistreatment.
But as for a patient who died where you are, young girl, it's 1935, and she dies of an overdose of Lysol. Now, Lysol was brought into the hospital to try and kill Spanish influenza after the First World War, but it's also used for contraceptives or for abortions. Now, how did this lady get this medication? We don't know. Now, in 1934, the only male that she would have come in contact is with the superintendent. So maybe he got her pregnant and said, "Here, drink this." We don't know. But she actually died because of it.
Mayday Hills Hospital was not the only mental institution where patients were mistreated and abused. These treatments were common practice in all mental institutions throughout Australia.
But I think it has to be understood that these places existed because that was what was considered the right thing to do at the time. I think you can blame lots of people and all the rest of it, but that's how things were.
And they've got a completely naive view about what the mental hospitals were like. They think, people are caring for them, they've got food, they've got a bed, and they don't realise how awful they were.
around. Hey!
Well, you guys
Crossover.
funny. Yeah, perfect timing, eh?
Exactly. Oh, pity Juan couldn't be here today. Let's check out his doco.
Yeah.
Now, it's very hard to explain, but
Wow, tough question.
Yeah, kind of. Not really. Was that a party? He probably was. He probably doesn't remember.
2 weeks ago was your first kiss?
first kiss.
Yeah?
What's your passion?
Our first kiss was kind of, I don't really remember it that
Yeah, I
much.
don't remember mine.
Yeah, I do remember.
You should.
Robbo's, our mate Robbo's house.
No.
Yes, it was.
No, it wasn't.
And we were hiding in the bushes from the teacher so we wouldn't get busted kissing. Yeah, it wasn't real.
First things first. Look the part. How a man dresses is very important. You want that girl? Haha. Well, start dressing right, buddy. This involves looking smart, grooming, and general hygiene. But hey, go easy on the cologne. If you look good, you're going to feel good. Begin with eye contact. The first indicator a woman is interested in you. Practice your eye contact. Remember, you don't want to look like a creep, so keep it classy.
It was believed that the soul was in the breath, and so that when you kissed somebody, it didn't have to be a sexual kiss, but when you kissed somebody, then your souls were entwining, and therefore they could fuse throughout eternity. How beautiful is that?
My first kiss ever was when I was about 10 years old in grade 5, and we went to the local blue light disco. And we thought, let's just give this a crack. So I was the first one to build up the courage to do it. And yeah, it was messy.
We went to the movies and then we went to the beach and it was freezing cold and he cuddled me because I was cold and then he kissed me.
Well, I was on a boat with this guy and well, I don't know, we were kind of just like lying on the deck and he full on just went in for it and I was like, okay, cool.
My first kiss was summer holidays, up in the mountains camping. This girl that I've known from going up there for many years of going up there, brought a friend up one year. It was love at first sight.
I think I was like 11 or 12, I was in like year 6, it was kind of crap. Kind of like jumped on me, attacking. It wasn't good.
Spent all day by the river swimming. On that night, a windy night, sitting at the playground at the park. We were swinging on the swings, is that how you say it? And she grabbed me hands and we went off to my tent and let the magic happen.
I remember my first passionate kiss where the guy stuck his tongue down my throat, and it was my dancing class and he drove me home, so I would have only been about 16 and he would have been 18 with his car.
It was in a park, very romantic. I was in Echuca on holiday and it was in a BMX track with some boy I met there. It was like an episode of Grease. It was like Grease the movie. It's like summer love and it really was. How was your first kiss?
I was at a party. I don't remember it. It was with a random.
It was last week.
Yeah.
I was in the movie theater and with my boyfriend and then he kissed me.
The first kiss I ever had was when I was, I think, 14.
and it was it was with a boy that I was dating for 2 weeks.
Well, we're sitting in the forest and she was with her brother and I was with my sister.
And it was behind La Piquetta in Williamstown. And it lasted about 2 seconds.
Yeah, it still stays in my head as clear as what it was. It was very funny because I told her that there was a bird in her side about to go and pick on her, and she turned around and I kissed her on the cheek.
The first kiss was in Orpheum, that's in a theater in Xira in Malta, and that kiss for me means my life now, because we've been married for the last 45 years now.
Oh, so you want that girl over there? Well, look at yourself, will ya? Ask yourself, would you approach you? Conversation. Keep it simple. None of those phony pickup lines. Just say, hello dear, can I get you a drink?
Hello dear, can I get you a drink?
But I mean, when we talk about kissing, we talk along a continuum, don't we? We talk from, a friendly peck, which is to say, hello, I see you, I connect with you, through to a passionate sexual kiss.
And a kiss replaces all of those words you can't find just to explain what you feel for that person.
It feels like sex happening in your mouth. That's how it feels.
It's wonderful. And it's a shame that once we are in a position to be having sex frequently, we forget how wonderful that kissing is. And it could, therefore, always introduce the sex and make the connection even better.
Kissing is a starting point or a stepping stone pretty much to sex.
I like things to progress. When I kiss a girl, I want it to progress further. Try get into her pants, slowly take her home, and then the rest is history.
It's got a feeling which is undescribable pretty much. You could say heaven.
And it's transporting, it takes you to a place of floating.
Whilst talking to her, look for signals. Positive signals, constant eye contact and smiling, licking of lips. Negative signals include searching around the room and looking uninterested. When you think you have got enough positive signals, go in for the kiss. But remember, make it smooth.
What are you doing? What the hell was that? And why are you pushing my head?
I thought you were interested.
And why would you think that?
Because you were smiling at me from across the room.
I was laughing at you. You were pulling these ridiculous faces and I was thinking, what an absolute loser. What, do you think it's that easy? Just follow a few simple steps and you can kiss anyone you want?
Oh!
And here comes my boyfriend.
That's great.
Yeah.
We got walls to prank calls. I know who that's coming from. My old lover who.
Did you get that? Did you get that?
We got flowers by the bed, a little silver over our head. We painted it for Yoko. Oh no, 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 no. I have you have me. You know, love may never truly be free, but it is cheaper than the price of gasoline.
So cute. Yeah, it was.
Yeah. Such an interesting range of people. How did you manage to find everyone? for
Yeah,
that?
well, there's just the street interviews were randoms walking past that we found on the day, so that was very convenient. But the couples were all planned interviews. We just wanted to make sure that we'd covered sort of a broad demographic to get the different opinion experiences across the ages.
Really good.
Yeah.
And what about those olden day skits? How did you do that?
They were actually filmed at uni.
Okay.
Yeah, we just got some actors in, sort of told them what to do, and then in the edit suites we dropped in a filter over the top and made it look old
Yeah, it
fashioned.
looked really effective.
Yeah,
it looks
it turned out really well.
Yeah.
We're pretty happy with it.
Funny little doco.
Yes.
Hey guys, one just came online.
No way!
Hi.
Oh wow. Say hello. Hey,
Hi,
Juan.
Juan.
Hi, buddy.
We just watched a documentary.
Really, really good.
Next week, on Real, Alana and Rachel return to bring us another showcase of documentaries. In Wings, we meet a quadriplegic who shares his passion for flying and his determination to become a pilot again. Then, in A Cause to Smile, we meet a CEO of a children's charity who fights to keep his charity afloat, despite a grim global financial climate.